Max is a 7-year-old male mountain lion owned by a wildlife rescue organization. Max was not feeling well. For a few days he has been vomiting and he hasn't been eating, which is very unusual for him. Upon arrival at Access, we tried to find out the reason why Max is not feeling well, and we took some radiographs of his abdomen and did an abdominal ultrasound, both revealing some foreign material in Max's stomach. In order to try and retrieve or remove the foreign material in the least invasive way, we attempted endoscopy or gastroscopy first, but unfortunately the foreign material was very well lodged in Max's stomach, which did not allow us to remove it via using the scope. Since the gastroscopy was unsuccessful, we were forced to take Max to surgery and perform a gastroscopy, which is a procedure in which we open the stomach and then retrieve the foreign body that way. The foreign material ended up being a part of a plastic hose or pipe that was well lodged into Max's pylorus, which is the outflow tract of the stomach. Max recovered very well, and he went back to his rescue organization the day of surgery, and within the next day he started eating and feeling much better, and he completely recovered within a couple of weeks. If we didn't remove the gastric or stomach obstruction that Max had, he would have continued to waste away, feel very sick, and become dehydrated, and eventually he might have died. The gastrostomy surgery is a relatively common procedure. Unfortunately, both dogs and cats love playing with items that they should not swallow. So pieces of toys, clothing material, and other objects sometimes are swallowed by our patients, and a lot of care should be taken to what items your dog or cat are playing with. Max is certainly one of the bigger cats that we've operated on in our hospital. Typically we operate on domestic cats and dogs, which of course most of them are much smaller. The greater challenge with this case stems from the fact that Max is a wild animal, and so of course it's impossible to place an Elizabethan collar after surgery, and preventing him from licking or self-damaging his incision is difficult. So those were the challenges of kind of how to close a surgical incision in a way that Max wouldn't harm him, and the post-operative management is of course somewhat more challenging than a domestic cat that lives in a much more controlled environment. In order to prevent Max from harming his incision, we used only internal sutures, so there were no sutures or staples in the skin that will cause any irritation. The tongue of a cat is extremely abrasive, especially a cat as big as he is, and they have little prongs or spikes on their tongue that can be super irritating to a surgical incision. Of course, large cats and other wildlife such as Max should only be cared for and held via licensed organizations such as the one that Max is a part of. These animals should not be kept in a backyard scenario, and it's also illegal to keep these animals in such environments in California.